My name is Areo Nazari. I'm the CEO of CaryHealth. At our core, we're a pharmacy and digital health organization because we are working beyond just pure pharmacy. We're pharmacists, we're technologists. My CTO came from a company called Kinetica, and it's a geospatial database. So we've taken a lot of that knowledge of geospatial data analytics, combined it with pharmacy, and that's how we got everything that we built. I grew up in Columbia, Maryland. Came from a family of entrepreneurs and just always had my mind active thinking of opportunities out there. After graduating from pharmacy school, I was really a pharmacist on the ground, which was great. I got to experience everything as a pharmacist, whether that was working with patients, using the infrastructure that Rite Aid had, experiencing the highs, the lows, the good infrastructure, the bad infrastructure. That really shaped my view of what was possible and what was needed. I'll give you an example. Prescription delivery at Rite Aid. Every time we wanted to do a prescription delivery, we'd have to call the one driver available in the entire region, and he would only come one day, probably every 2 weeks, sometimes every week. And patient credit cards were stored on index cards in lock boxes, and lock boxes were stored in a safe, which was our controlled substance safe. So imagine every time I wanted to ring out an order for delivery, I'd have to go through this maze of combinations. I remember just going through that and thinking there's got to be a better way to do all this. And so that helped really start framing the conversation with my partner, Nima, who as a patient himself had a lot of bad pharmacy experiences. So we got together and started thinking through ways that we could make a better pharmacy experience. And eventually, even though we launched the company in 2017, we started working on this in late 2015. We actually thought through a lot of different ways to approach the problem, because the real problem was the patient experience, right? Getting prescriptions delivered. So we looked at different routes. Our initial route, we even thought about being the red box of pharmacy, right? Like setting up like depots and having patients show up at the box. But we knew, you know what, that's not the way. Like that's not a good experience. Then our next phase was, all right, what if we connect independent pharmacies to delivery drivers? And we just facilitate everything in between. So the patient experience, coordinating delivery, automation. The problem was back in 2015-16, the pharmacy systems that pharmacies use to operate their business were not open and readily available. So long story short, we couldn't go down that route. We wouldn't be able to create an ideal experience, both from a technical perspective, but also front-facing for the patient. So we realized in that moment that we have to be the pharmacy, we have to be the technology, and partner with a logistics company to handle last mile. 2017 was just DC, Maryland, and Virginia, and the initial business model was an Uber for pharmacy type of experience. So we were just delivering within about a 20 to 25 mile radius. Now we ship nationwide, all 50 states, and we're more focused on the specialty vertical. Around roughly 2020, we started to look at opportunities to expand our business model. So we decided to take everything that was working in that retail experience, and that was the patient experience, right? Patients loved our mobile app. They loved chatting with our pharmacy team. They loved being able to track their order in real time. And we've now expanded into several different software platforms, including OneDash. We also have a generative AI clinical reference called Claire. We have a platform for pharma manufacturers that helps as a commercialization co-pilot called OnLabel. Even though it may look like we have a bunch of different products, they all really go hand in hand. Our initial contract was with CareFirst, Blue Cross Blue Shield, their DC managed care organization. And so they were extremely supportive. We connected with their team. This was during the early days of COVID. The initial idea was, let's help them deliver prescriptions to underserved areas, like Ward 8, where pharmacies were unfortunately shutting down. That created pharmacy deserts. So I would say the DC team CareFirst team was very supportive, very collaborative. It was a great launching pad for us to build that product and that platform. And specifically, one reason why they were motivated, I wouldn't say it was the only reason, but one reason that it could be mutually beneficial for them was a program called CBE, Certified Business Enterprise. It was very helpful in us getting that initial contract and really kicking off our initial software product. Some of the benefits in DC, it's a great place to work, live, and play. Great place to have an office, great place to provide for your team and make an environment that's conducive to producing good results. We haven't had challenges, and I think sometimes when there's nothing notable, that's probably a good thing, because that means if you've had an environment where you could just focus on your business and succeed. I'd say we've been able to find talent, we've been able to find a great office, so all those things came to play, and it's been nothing but a benefit. One of the motivating factors for us to stay in DC has been QHTC, so the Qualified High Tech Incentive. A lot of that is about tax incentives and benefits for you and your team. And so we've viewed QHTC as one of the most competitive, let's call it state, even though we're not a state yet, hopefully one day, but let's call it one of the best state incentives I've seen as far as providing for companies. I would say to any company looking at DC, take a look at QHTC, and it can be very beneficial for not only you as a founder, but for your organization in general. DC has great infrastructure. I mean, it's easy to get in and out. If you're putting your office in the suburbs, I think there's one option, that's drive to work. Here, people can drive, people can metro, people can bus. There's a lot of different ways that you can get to the office. And then obviously people can live, work, and play here, and so I think it's convenient. So yeah, I mean, I think between that and just having a great ecosystem of businesses, startups, like-minded people, a government that's generally supportive of growing business, I think these are all great things. So I think it's a great place to have a company, and there's a lot of great restaurants around, right? So when you're done with work, you can go to a happy hour and meet up with friends. I actually just bought a home in DuPont, so I'm going to try and be here for the foreseeable future.